How
Hi,
you doing?
I'm good. How are you?
Good. My name is Jalen. I'm going to be your nurse practitioner student. I'm from Valdosta State, and I'm just here to do your head and neck assessment. Okay.
Okay.
All right. So first, I'm going to do the interview process. Just going to ask you a couple of questions. Can you tell me your name, how old you are, and your date of birth?
Okay. My name's Andre Dickerson. I'm 29 years old,
Mm-hmm.
and my date of birth is April 20, 95.
Okay. Okay. Nice. So, Mr. Dickerson, what brings you in today? What happened?
I woke up with a sore throat like a week maybe ago, and it
Okay.
still hurts, so I don't know what
Okay.
to do about it.
Okay. No problem. Just a sore throat. That's
Yeah, just a sore throat. I felt kind of hot and like sweaty a little bit too.
okay. All right. Cool. Um, did it happen like suddenly? Were you around any sick people? Anything like that?
Not that I remember. I just kind of woke up with it.
Okay. All right. And you said it's been going on for how long?
A week?
A week?
Yeah.
Okay. And any cough, runny nose, congestion, anything else?
Yeah, I'm a little bit congested.
Okay.
Um, Not really. I mean, I'm kind of coughing, but it really hurts my throat.
Okay. Is it hurting for you to swallow as well?
Yes.
Okay. Is there anything that aggravates it?
Not specifically, just swallowing, drinking things, eating things.
Okay. And is there anything that alleviates the pain that helps it better?
Mint lozenges,
Okay. Okay, cool. Have you taken anything else over the counter? Any meds over the counter?
some Tylenol,
Tylenol.
uh,
Okay. And how often do you take the Tylenol?
just once a day.
Okay, once a day. Okay. So I'm just going to ask you about your past medical history. Do you have any like living, like diagnosed conditions that you have that you know of?
No, no,
Mm,
I'm healthy.
okay, cool. I'm gonna ask you a couple questions about your family. How old is your mom and dad?
My mom is 65 and
Mm,
my dad is 70.
okay, all right. Do they have any medical history that you know
No, they don't.
of? Okay, so great. Glad to hear that about your mom and dad. Can you tell me about your grandparents? Are they still living?
No, they're not.
No,
They
they're not.
passed.
Okay. Do you know what they passed from? Do you know?
Just old age.
Okay,
Yep.
natural causes.
Natural causes, exactly.
Okay. I'm gonna ask you about your social history. Do you smoke or do you drink?
I drink sometimes with friends on the weekends.
So, psychosocial drinker.
Yeah.
Okay. No smoking.
No.
Okay. Do you work out?
Yeah, I do.
How many times a week?
About three or four.
Okay. And where do you work?
I'm a lawyer at one of the offices downtown.
Okay. Nice. 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 All right. Um, any history of illegal drug use? Any substance use?
No.
No. Great. Any surgical history?
No, I've never had surgery.
Never had surgery. Okay. Do you have any medicines that were prescribed by a provider that you take routinely?
No.
Okay. You take any meds routinely?
No.
Okay. No. Okay. Next, I'm going to just review just your systems. I'm going to ask you a couple questions. Do you have any history of anxiety or depression?
No.
No. Okay. And what about your skin? Any rashes? Any excessive dryness, itching, anything open?
No.
No. Okay. And for your head, like, do you have any signs of like you're about to pass out or dizziness?
No.
No. Okay. And do you wear glasses?
Nope.
You wear contacts?
I did not.
No. Okay. Any history of ear or hearing loss?
No.
No. All right. Do you have any ringing in the ear sometimes?
No.
No. Okay. Um, do you have any history of like nosebleeds?
No.
No. Okay, good. And what about before like your symptoms right now? Any history of loss of smell?
No. Not before recently.
Okay. Okay. What about your neck? Is there any neck stiffness, pain? It hurts when you turn your neck or move your head up and down?
No.
No. Okay. What about when was your last dental exam?
A year ago.
A year ago. Any history of any gum disease,
No.
tooth decay, cavities?
No.
Okay, good. And what about your bowel habits? Any changes in that?
No.
Okay. When was your last bowel movement?
Yesterday.
Okay. Was it normal for you?
Yes.
Any traces of blood? Was it too dark?
No, I don't think so.
No?
No.
Okay. Any nausea or anything?
No.
No? Okay, great. Um, do you have any moments where you feel like your heart is racing? If you feel your pulse is like really going really fast?
Only when I drink too much coffee.
I gotta stay away from too much coffee.
Mm.
Next thing I'm gonna ask, do you have any history of like when you're sleeping, you kind of stop breathing for a moment and then you resume?
No, not that I know of.
No sleep apnea?
No.
Okay. Any wheezing?
No.
No? Okay. What about any signs of like numbness or tingling in your extremities throughout the day?
No. I don't feel that.
Okay. Histories of seizures? Anything
No.
seizure related? Okay. Do you have you ever had a blood transfusion before?
No.
No, no history of blood transfusion. And for your genitals, are you sexually active?
Yes.
Any discharge that's like odor, like a foul odor?
No.
Any burning?
No.
Anything?
No.
Okay. Any changes in like the way you urinate? Is it painful? Is it hard for you to start a stream? Anything?
No.
Okay, good. Any excessive like sweating? Do you feel like you're always thirsty?
No. No.
No. Okay. And what about your joints? Like, do you have like stiffness in your joints when you wake up?
No.
No. Okay. And I don't see like any swelling in your any of your extremities.
No.
Okay, good. All right, Mr. Dickerson, how tall are you?
I'm 6'2".
6'2", and how much do you weigh?
190 pounds.
190 pounds. Okay, okay. So I'm gonna just take a look at everything later and just send over a script to your pharmacy, okay, for that sore throat. Next thing I'm gonna do is just do the actual physical assessment of your head and of your neck, okay?
Okay.
All right, awesome. So I'm gonna perform hand hygiene first. All right. And this is being recorded. Do I have permission to do
Yes.
okay, to do the assessment? So first thing I'm gonna do, just looking at your head, looking all around, looking for any masses, any visual trauma, which I don't see. I'm gonna start palpating your scalp, okay? I'm just feeling for any masses. Also looking at the hair distribution. It is well defined. I don't see any baldness, anything like that, okay?
Okay.
The thing I'm going to do is I'm going to have you close your eyes, and then I'm going to touch you, and you just tell me when you feel my touch, okay? So close your eyes, okay?
I feel that. Feel that. I feel that. I feel that. I feel that.
Okay, awesome. All right, so next thing I'm going to do is have you do a couple of face expressions. So can you close your eyes? Okay, open. Can you raise your eyebrows? Good. Can you give me a smile? All right. Can you puff up your cheeks? All right, and let the air out. All right, and can you give me a sad face? All right, good. Next thing I'm going to do is I'm going to test your sensory. I'm going to stick this tongue blade, and you just let me know what you taste, okay?
Okay.
So just open up your mouth. I'm going to put it, and what do you taste?
Wood.
Okay, good. All right. Good. So cranial nerve 5 and 7 is intact. So next thing we're going to do is I'm going to just feel for your temporal arteries, okay? I'm also going to listen.
Okay.
That's cool. Alrighty, now I'm just going to take a listen with the bill of my stethoscope. Okay, no bruit. Okay, no bruit. And 2 plus on each side for your pulse of your temporal arteries, okay? Which is good. Next thing I'm going to do is feel behind your jaw. I'm just going to feel for the T and J. I'm just looking to see if there's any cracking or popping, okay? And you just let me know if you feel anything abnormal, okay? So open, close. Okay, open, close. Okay, awesome, awesome, awesome. So next thing we're going to do is I'm just going to take a look at your eyes, okay? So I'm going to grab my pen light and I'm just taking a look. I'm just looking at just, your eyelashes, your eyebrows. I'm looking at the sclera. They're both white in the left and right eye. I'm going to pull down your bottom eyelid. Okay, your conjunctiva is pink and moist, which is normal. I'm going to ask you to just look ahead. And I'm going to shine this light just to look at your pupils, okay? Okay. Okay. Pupils are equal, round, and reactive to light. And I'm also going to do another exam. I'm going to put this pen light right here. Only move your eyes and not your head. Just follow, okay? Okay, and then just keep looking, okay? Okay, so cranial nerves 2, 3, 4, and 6, they're all intact. Next thing I'm going to do is do the smelling test. So I'm just going to ask you to cover up one of your eyes, okay, and then read the lowest line.
LTFPH.
Good. All right. Cover up the other eye.
Okay. LTFPH.
Okay, great. So 20/20, that's normal vision for the left and the right eye, okay? I don't have an ophthalmoscope, but if I did, I would look at your retina and I'm just looking to see if the optic disc margins are sharp and just looking to see if I see any trauma, any redness, any bleeding, anything abnormal, okay? I was just trying to light, but I don't have an ophthalmoscope to do that, okay? Next thing I want to do is take a look at your ears. Just taking a look at them, just making sure I don't see anything concerning, anything that's abnormal, which I don't see. Next thing I'm going to do is just palpate. All right, do you have any tenderness?
No.
No, just want to go back to the pinnae. Any tenderness here?
No.
All right, good. Next thing I want to do is just shine a light in your canal, and I'm gonna pull your ear up and back. Just looking to see if I see any redness, any swelling. Okay, your tympanic membrane is pearly gray, which is normal. And again for the other ear, up and back. All right, and pearly gray for your tympanic membrane. Don't see anything that's abnormal. Okay. Next thing we're going to do is the Weber and the Ron test. So I have a tuning fork and I'm going to ring it. So these tests, they just test for hearing loss. So I'm just going to ring it and you just let me know if you hear it in both ears, on one ear or the other, okay?
I hear it in both ears.
Okay, great. So the Ron test, I'm just going to ring it, put it behind your ear at the mastoid process. You just let me know when you stop hearing it, okay? Just say the word stop. And then I'm going to put it here and you just let me know if you still hear it or not.
Okay.
Okay?
I stopped. I hear it.
Okay. Okay. Same for the other ear.
I stopped. I hear that.
Okay. So the air conduction is greater than the bone conduction on the left and the right ear, which is positive, which is what we want to see and it's normal. Next thing we're going to do is the whisper test. So I'm going to ask you to close one of your ears. Okay, and I'm just going to whisper, and you just repeat the words that you hear, okay?
Okay. 1, 2, 3.
Okay, and then close the other ear for me.
4, 5, 6.
Okay, awesome. So cranial nerve 8 is intact. Next thing we're going to do is I'm going to look at your nasal cavity. All right, I'm just gonna take this pen light. Can you tilt your head up? And I'm just looking to see if I see any deviation. I don't see any bleeding. I can tell it's a little red on one side just because you've probably been blowing your nose and sneezing just because of your symptoms, which is normal. So I'm going to ask you to close your eyes. I'm going to put something near your nose, and then you just let me know what you smell, okay?
Okay.
Okay, take a sniff.
Oh, smell rubbing alcohol.
Yeah, okay. Pretty strong. So cranial nerve 1 is intact. Okay, next thing we're going to do is I'm going to take my pen light and this clean tongue blade again. I'm just going to take a look into your mouth, okay? Looking to see if I see anything concerning. So open up. Okay. Okay, so I see valid. Don't see anything concerning. No trauma. Everything is pink and moist. Can you say "ah" for me? Okay, great. So your uvula rise and fall, and your tonsils, they're both equal. No edema, no swelling. Okay. I'm also going to test for your gag reflex. So can you just open up your mouth? I'm going to stick this in the back of your throat, and I'm just testing for your gag. Okay. Okay. Yeah, that's normal. You may cough. Okay. So cranial nerve. Wait. Let me ask you to stick out your tongue. Close your mouth. Stick out your tongue. Move from left to right. Okay. Any pain?
No.
Anything? Okay. And cranial nerve 9 and 10, they're both intact. So next thing we're going to do, take a look at your neck. I'm just looking to look at your neck, see if I see any goiters. All right, which I don't see. I'm just going to feel your trachea. Trachea is midline. All right. Just going to palpate your thyroid. Can you swallow? Okay. The thyroid goes up and down as you swallow. I'm going to put my hand on your shoulder, and I'm going to ask you to just shrug. And we're going to give you some resistance, okay?
Okay.
All right, so shrug. Okay, good. So cranial nerve 11 is intact. Next thing I'm going to do is just palpate your lymph nodes, okay? So I'm going to get behind you. I'm just going to go above your ear, right above like your tragus area. Any pain?
No.
All right, going to go behind your ear. Any pain?
No.
No. Going to do your occipital here. Any pain?
No.
All right. Your posterior cervical.
No.
Any pain? All right. And then raise up a little. Raise your head up. Your submandibular. Any pain?
No.
All right. The submental. Any pain?
No.
All right. And then I'm also going to get to the front to do the anterior cervical. Okay. Any pain? Okay. I'm also going to take a listen and feel for your carotid, okay? So this one's a little bit different. I'm just going to feel, so just breathe normal, it's fine. Okay, 2 plus. Okay, 2 plus on each side. So just breathe normal. I'm just going to auscultate, but I am going to ask you to take a deep breath in and hold it, okay? Just going to listen if I hear any bruise. So take a deep breath in, hold it. Okay, no bruise. And take a deep breath in, hold it. Okay, and no bruise as well. Alrighty, well, this concludes the head and neck assessment. Can I help you with anything? Do you have any other questions or concerns for me?
No.
All right, well, it was nice meeting you, Mr. Dickerson. I will send those medicines over to your pharmacy, and I will expect to see you as a follow-up appointment in the next 2 weeks, okay?
Okay, thank you.